Hey everybody, this is Dr. Lori Langdon with a quick video to answer the most commonly asked question I get this time of year from friends and family and patients, and that is this situation of my child's illness right now bad enough to justify an emergency department visit? So first of all, a couple of things. Remember, we're not fever phobic. The actual number of fever doesn't make your pediatrician say you must go straight to the emergency department unless they're a newborn. Entirely different story. That's a different video. But for toddlers, older children, teens, adults, the fever alone or the actual number of the fever doesn't make us tell you to go straight to the ER. Now, if it's extended, average, we'll say past 5 or 6 days, that could also be a different story. But if you called me and said the baby, well, not the baby, not the infant, but the toddler, older kid is 104 degrees, I don't care so much about the number 104. I care about, are they drinking fluids? Are there signs of dehydration? Look inside their mouth. Is it dry, sticky, cottony? Have they had at least 3 urine outputs in the last 24 hours? So most common reason to recommend parents go to the emergency department is dehydration. That is fewer than 3 urine outputs in 24 hours, dry mouth. An infant could have a flat, their soft spot, their anterior fontanelle was sunken. They could have sunken in eyes. All those are signs of dehydration. They might not pink up if you push on an area of skin and let go. Their capillary refill may be slowed. Their skin turgor, or if you pinch their skin, does it bounce right back into place or does it stay sort of in a pinched? That would be very, very late sign of dehydration, very bad. So any dehydration, that would justify an emergency department visit. Some urgent cares do have IV fluid capabilities, most don't, so just be aware of that. Number 2, respiratory distress. We are getting slammed with RSV right now. So for an infant, nasal flaring, grunting with each expiration, breathing fast, hard, heavy, ribs going up and down with the skin sucking in between the ribs. And if they're older than 6 months, their belly muscles working in and out to help them breathe. Shoulders bobbing, head bobbing, all a bad sign of respiratory distress, and they should be seen even if it's the weekend, even if it's the middle of the night. Next would be some obvious things like altered mental status. That's our phrase. That is, your baby is not acting right. They won't respond to you. They're extremely lethargic. Something's wrong. They're just acting weird. And then we didn't cover, but obviously if you're in a car accident, if there was a large laceration, uncontrolled bleeding, seizure, there are lots more reasons. But from just being sick, with what's going around right now, typically flu A and RSV is what I'm seeing a lot of, then it would be dehydration and respiratory distress. And remember, listen to these words of wisdom. If your child has a genuine pediatric emergency, they deserve a genuine pediatric emergency department. Hope that helps. Thanks.